Hello everyone, my name is Dr. Usha Krishnan. I'm a pediatric gastroenterologist from Sydney Children's Hospital in Randwick, and I'd like to talk to you today about blended tube feeding in enteral feeding, a consensus statement on behalf of the AuSPEN Btf working group. Now, what is Blenderised Tube Feeding, or Btf as I shall be calling it from now on? Btf is the use of blended foods and liquids given directly via a feeding tube. Blenderized feeds could refer to homemade Btf, commercial formula mixed with pureed baby food, or any of the variety of commercially available ready-to-use Btfs. The use of Btf is increasing in popularity globally. What is the purpose of these Btf guidelines? The aim is to provide support to dietitians and health professionals who treat patients, be they be children or adults on enteral feeds, with the use of enteral blended tube feeds by summarizing current research and expert clinical consensus. How was this consensus statement created? A panel of multidisciplinary experts, including dietitians, nurses, and gastroenterologists, conducted a systematic review of the evidence on Btf. Evidence was graded using two guidelines, the NHMRC levels of evidence and the ADA method of analysis. The Delphi process was used to reach a group consensus after all the evidence was graded. Voting was anonymous. Members of the AuSPEN Btf working group included Claire Riley, a senior pediatric dietitian from Queensland Children's Hospital, Nicole Ross, the Assistant Director of Nutrition and Food Services, Gold Coast University Hospital, myself, a pediatric gastroenterologist from Sydney Children's Hospital, Randwick, Dr. Jason Yap, a pediatric gastroenterologist from the Royal Children's Hospital, Melbourne, Stacey Verteen, a pediatric dietitian from Gold Coast University Hospital, Joanne Mason, a senior pediatric dietitian from the Mid-Central District Health Board in New Zealand, Rachel Lindeberg, a senior pediatric dietitian from St. George Hospital, Sydney, Rachel Martin, a pediatric dietitian from the Royal Children's Hospital, Melbourne, Kelly Josh, a senior pediatric dietitian from Perth Children's Hospital, Jenna Riley, a dietitian and hen coordinator from Peninsula Health, Victoria, Fiona Arrowsmith, a pediatric dietitian from the Children's Hospital, Westmead, Sydney, Rebecca Gurr, a pediatric dietitian from Christchurch Hospital in New Zealand, Carmen Liu, a pediatric dietitian from Royal Children's Hospital, Melbourne, Karen Coster, a pediatric dietitian from Royal Children's Hospital, Melbourne, Shani Drake, adult dietitian from Peter MacCallum Cancer Centre in Melbourne, Kellyanne Innes, a clinical nurse consultant and pediatric nurse navigator for the gastrostomy, who is also a gastrostomy clinic nurse from Gold Coast University Hospital, Louise Webley, an adult dietitian from Gold Coast University Hospital, and Miss Neha Chandrasekhar, a medical student from the University of New South Wales. Now, what are these consensus statements from the AuSPEN Btf working group? Statement 1. The essential members of the multidisciplinary team for recommendation of Btf in children and adults should at the very minimum include a gastroenterologist or other physician involved in regular care of the patient, a dietitian, the patient or patient's family and caregivers. Statement 2. There are many considerations when determining patient suitability for use of Btf. However, given lack of high-quality evidence, caution and clinical judgment should be applied for people who require continuous feeds, as homemade Btf are non-sterile and thus have short hang times, and we need to avoid risk of bacterial contamination and foodborne illness, and this is one of the reasons why Btfs are unable to be used as continuous feeds. Many Btfs are too viscous to pass through a feeding pump. Caution and clinical judgment should also be used in patients having a jejunostomy, as whole foods cannot be absorbed into the jejunum. Similarly, For patients on a fluid restriction, again caution and clinical judgment should be used as fluid is needed to thin Btfs, which are typically more viscous than formula, hence Btf are often provided in larger fluid volumes than commercial formulas. Caution and clinical judgment should be used for patients who have certain medical conditions such as metabolic disorders or multiple food allergies, as these patients may not receive adequate caloric, micro and macronutrient intake on the Btf alone due to multiple food and nutrient exclusions. And finally, caution and clinical judgment should also be used in patients who are at a high risk for infection, such as patients on chemotherapy or patients on multiple immunosuppressive agents, as homemade Btfs are non-sterile and have a higher microbial load and infection risk compared to standard commercial formulas. Statement 3. Btf may provide some benefit to the patient, including improved feeding tolerance and patient and caregiver quality of life and satisfaction. Enteral nutrition in a large proportion of patients, sometimes up to 70%, can be associated with adverse gastrointestinal symptoms such as nausea, vomiting, gagging, retching, constipation, diarrhea, and stomach pains, all of which in published studies are shown to be decreased with the use of Btf. Whether this is due to improved gut microbiome health is currently not known. Btf use has also been associated with psychosocial benefits such as increased parental satisfaction, and the children themselves are perceived to be happier by the parents. Statement 4. The potential disadvantages, on the other hand, of Btf may include impaired growth in children and malnutrition in adults if not monitored by an experienced dietitian. This is because patients on Btf often require over 120% of their caloric requirements when they're on Btf to maintain adequate growth and nutrition compared to those patients who are on standard commercial formula alone, hence the need for regular close monitoring by an experienced dietitian. Btfs can be associated with gastrostomy tube blockages due to increased viscosity of the Btf. There's a time burden for Btf preparation. There's a requirement for a high-powered, expensive blender, and like mentioned previously, there's an infection risk due to contamination. Statement 5. The following dietitian monitoring timeframes for patient using Btf is recommended. This applies both to pediatric and adult patients. At the time of initiation of Btf, this could be 1 to 3 monthly, and for patients stable on Btf, this could be 6 monthly. Ongoing monitoring with a dietitian is essential to ensure that growth goals are met in children requiring tube feeding. Statement 6. It is recommended to consider the following when recommending, preparing and administering Btfs. Firstly, Btf can be considered for patients who are over 12 months of age, have motivated caregivers who are aware of the risks associated with Btf and are willing to work with the dietitian to ensure adequacy of Btf. Those who have a mature and healed stoma site, and those who have a low infection risk. Secondly, caution and clinical judgment should be used in implementing Btf for patients who are medically unstable with an increased risk of infection, have a small feeding tube size less than 14 French as the tube may become clogged, and in those who have poor growth, as previously mentioned, Btf use has been associated with poorer growth when not monitored by a dietitian closely. Patients, carers, and parents of children with Btf need the ability to follow a Btf recipe and regular dietitian reviews to ensure that the macronutrient, micronutrient, and caloric adequacy is met. They need to be able to follow appropriate food preparation and food handling techniques, have the appropriate equipment, storage space, kitchen, fridge, freezer to safely prepare Btf, and need the ability to consider the risk of food allergy with Btfs, especially when introducing foods in Btf that may cause an allergenic reaction. Statement 6. The following points are in line with current literature for the safe preparation and administration of BTF. Administration of BTF to infants less than 6 months is discouraged in line with general recommendation on starting solids. Adding cow's milk to the BTF is discouraged for infants less than 6 months in line with general recommendations by the Australian Guide to Healthy Eating and the New Zealand Guide to Healthy Eating. We need to consider the viscosity of the BTF when adjusting of the nutritional profile of the commercial BTF if they require addition of water to thin them out to prevent clogging of the gastrostomy tubes. BTFs must be prepared using safe food handling techniques and stored in a refrigerator immediately after preparation and discarded if unused after 24 hours. The hang time of BTF at room temperature should be less than 2 hours. Administration of BTF as a bolus feed via a syringe as a push method should be done with caution taken on the viscosity of the BTF. Administration of BTF is recommended as a bolus feed as it is not well suited to a feeding pump due to risk of bacterial growth and potential tube cloggages. We should sanitize all mechanical equipment, including blenders, used in preparing BTF after each use appropriately. Statement 7. The following information should be given to the parents and patients prior to and after the commencement of BTF, including information on food safety for preparing BTF, a list of recommended equipment required for BTF, information on the variety of commercial BTF available, information on the risks involved with BTF, such as tube blockages and infection risk, support group information, including information about the OLE Foundation and Feeding Tube Awareness Foundation. A copy of the intended use statement for the parents and carers to sign if they wish to use BTF as an inpatient in their local hospital if it was available. The Australian Guide to Healthy Eating as a base of recipes, and the New Zealand Food and Nutrition Guideline. Statement 8. The consensus opinion is that BTF can be used as a sole source of nutrition, provided the patient is able to maintain nutritional status and growth in the case of children, and the recipes used meet all the nutritional requirements and the patient is regularly monitored by a dietitian. Statement 9. Consensus opinion is that non-sterile BTF should not be administered into the jejunum due to microbial concerns, absorption capacity of the jejunum, and the other limitations associated with jejunum feeds. In conclusion, blenderized tube feeds can be very beneficial to tube-fed children and adults. However, care must be taken to ensure that it is used safely. Thank you very much.